It's been 76 days since I picked up my camera. It's the thing I love the most, but sometimes there are greater forces at work and there are things that just have to take priority. Health is one of those things. So to those who are interested in my little corner of the internet, this is where I've been. Hi. It's been quite a while, and I missed you. I missed you guys. How are you? What have you been up to? I hope you've been well. I'm not really sure how to start this video. It's going to be kind of just a sit-down-y, talky, update-y, story time kind of video, covering a lot of medical topics. So I just want to say now that if you are someone who doesn't really like medical stuff, or if you're bored of this video already, that's fine, you don't have to stay. Even if you don't watch the rest of this video, please just take away this one very important message, and that is to take care of your health. If you are offered routine screenings or checkups or anything like that, please take them up on that offer. Please go and have those routine checkups, because it could just save your life. And I know that sounds quite dramatic, but it really could. And I am someone who has avoided hospitals and doctors and everything for 13 years, and my opinion has completely changed over the past few weeks. So yeah, if you don't watch the rest of this video, that's fine, just please take away that message. Okay. Please keep in mind that I am not a medical professional. This video is not advice, and all information in this video is purely based on my own recent experience. Information sources for the visual pop-up throughout this video are from credible sources such as the NHS, Cancer Research UK and Macmillan Cancer Support. Links will be in the description for those who might find them useful or helpful. Thank you. Beverage of the day is a vanilla iced coffee. Okay, so going back about 2.5 months, not long after I put out my last video, it was a Friday evening, and I discovered a lump. Now, anyone who discovers a lump or any change to their body knows that you kind of freak out a little bit, maybe. I am one of those people. I discovered this lump, and it was actually in my armpit, which is a little bit of a strange place to get a lump. So this was on a Friday night, so I couldn't contact a GP. It was a bank holiday Friday as well, so I couldn't contact a GP until the Tuesday. So I spent that entire weekend obviously assuming the worst. So Tuesday rolls around, I phoned the GP, they managed to get me in that afternoon, and because of where the lump was, she carried out a breast exam to check for any other lumps, any abnormalities in that area, and she couldn't find anything that I'm aware of. She didn't say either way, but she didn't know why the lump was there, so she referred me to a breast clinic, which obviously looking back, yes, of course that is just routine, because obviously you have lymph nodes that kind of come up all the way, and it's all connected to kind of like the breast tissue. So she referred me there, you know, just to be on the safe side, said I would get a letter within 2 weeks, and I tell you what, those 2 weeks were really long. I did get a letter through from the GP, just kind of confirming what we spoke about, and there was some information on my urgent referral. Now, when doctors use words like urgent, it puts the fear of God in you, I won't lie to you. So I saw that, kind of stomach sank, like I just felt unwell, to be honest with you. So I was waiting for this other letter to come through, my appointment letter, and that took nearly 3 weeks, I think. And then when I did get the letter, my appointment was then the following week. So from start to finish of that already, it's been about 3 weeks since close to 4 weeks since I A, found the lump, B, got seen, and C, was referred and got my appointment letter through to go to the breast clinic. During this time, I also went to have my cervical screening. Now, if you're unfamiliar with cervical screenings, they are offered to anyone with a cervix aged 25 and over. You normally would get a letter about 6 months before your 25th birthday to invite you for your first screening. And then you have to have one, I think you're offered one then every 3 years onwards. So timeline, we've got found lump, went to GP, and during this time I also booked in for my cervical screening. Now I'm 30 years old and it was my first screening. I don't know why it took me so long again to rebook it, I just don't know. Anyway, so I think they sensed that I was quite anxious, so they were really sweet. They booked me like a pre-appointment before my screening so I could talk to the nurse, and she kind of talked through everything that was going to happen. So it's basically just a small, very small procedure to take some cell samples from your cervix. The whole thing, my friend came with me, she was really good. So that was actually quite a positive experience. My nurse was really lovely. And then I was told that I would get the results sort of within 6 weeks. Anyway, I was very proud of myself. I'd done the screening, it was over with in my mind. After that is when I got my letter for the breast clinic appointment. So at this time, I've got kind of two things going on. I've got my cervical screening, which in my opinion, in my eyes, was done and dusted. So I was quite proud of myself for that. I just had to get the results through. It was going to be like 6 weeks or within 6 weeks. So I kind of pushed it aside a little bit, didn't think too much of it. And I was more focused on the immediate of going to this breast clinic. And I was told that I could have a biopsy. They might do some other stuff, scans, ultrasounds, all sorts of things that terrified me, to be completely honest. I've just spat coffee all down myself. My goodness. So fast forward, this was about 3 weeks ago actually that my breast clinic appointment was at the hospital. So I went to that. I wasn't really sure what was going to happen, but again, they were all super lovely. All the nurses were really, really kind. And they carried out another breast exam, had a look at the lump, and then they referred me to the ultrasound department. I won't go into loads of detail because there's a lot to cover in this video, but went to the ultrasound, and I got to see the inside of my armpit. Highlight of my week, must say. Very strange. But she said there and then, she kind of had a look, and there was a couple of minutes of just silence, which obviously I was terrified at. After about 2 minutes, she said, nothing to worry about, nothing at all to worry about. And I was like, really? And she said, no, no, no. And then she showed me the lump, and basically it was a blocked, I can't remember, oh, a sebaceous cyst is what she referred to it as. And it was basically just a blocked hair follicle. It was a blocked hair follicle. I'd obviously cut myself or something at some point, and a tiny, tiny bit of bacteria had got under the skin and just... So yeah, got home on that Friday. I was obviously very, very relieved and very thankful that it was nothing sinister and that there was nothing wrong. I spent that weekend kind of on a bit of a high, really. And sort of during this time with this news, I'd kind of forgotten about my cervical screening. So Monday rolls around and I'm still in a really good mood. I'm like focusing on work and I'm like, right, I'm gonna get back into the swing of things. And I was just feeling very, very thankful. Until that afternoon, that Monday afternoon, the Friday after I'd been to the clinic, I had a phone call from a number I didn't recognise, and they called 3 times, and I was working at the time, so I was like, I'll just call them back. And then I got a notification to say that I had a voice message that was like 1.5 minutes long, and I was like, oh, I'll just listen to that while I'm, you know, making a coffee or whatever. And it turns out it was the hospital, and I was a bit confused why they were calling me, because I'd already been and been cleared. But it was a different department that was calling me, and they wanted to let me know that the results of my screening, my cervical screening, had come back and weren't great. They'd already booked me an appointment for the following week and told me that they would, a letter would be following with this information and some patient information. And I immediately felt nauseous. I felt, I don't really know how I felt. It was almost like despair, almost. And I'd been on such a high, so I fell even harder, if that makes sense. I had to wait maybe 2 or 3 days for these letters to come through. All I had was that voice message, so I listened to that a few times. And all I knew was that there were abnormal cells that needed urgent examination. So anyway, my letter came through and it had 4 different leaflets of information sheets for different procedures, and I also got my results letter so I could see it in person, and they found changes to the cells, and they referred to those changes as high-grade severe dyskaryosis, alternatively known as CIN3. Can't remember what the CIN stands for. It's no, I can't remember. I might put it on screen if I remember. And when you see things like high grade and severe, whew, it's making me feel weird even like thinking about it now, but seeing that written down was just, yeah, it wasn't a great feeling. I also explained in the letter that these particular changes are most commonly caused by the HPV virus, which they also found positive at my screening. If you're unfamiliar with what HPV is, it's human... I'm gonna have to put that on the screen because I can't remember. But it's basically one of the most common viruses that you can contract. There are over 100 different strains of it. and there isn't a cure for it. The body will naturally just clear it on its own from the immune system. It's so common that in the UK 1 in 2 people has it, and 4 out of 5 people will have it at least once in their lifetime and not even know that they've had it, because there are no symptoms, generally no symptoms. However, if the immune system fails to clear it, it can linger on, and it can be it's the most common cause of changes to your cells in your cervix, to your cervical cells. Sometimes it's not picked up at screenings because it can also lie dormant in your body for up to, I think it's 30 years, 20 or 30 years. So you can contract it, it will go dormant, so it won't be picked up on these screenings, it won't be active, it won't be doing anything, and then it will just reactivate at some random point in the future, and then it could be picked up at a different screening. So I had my letters, I had my results, I talked through my results with my mum and basically tried to remain calm. Obviously, when you're told that you have kind of the highest grade of changes to your cervical cells that you can have, it's worrying, it's quite concerning. The high grade severe dyskaryosis, or CIN3, is a precancerous condition. It's not a cancer diagnosis, but it is a big warning sign that kind of needs to be addressed, as those particular cells, that CIN3 change has a higher risk of developing into cervical cancer. Obviously, words like that are not nice to hear or to think about. So yeah, a lot was going through my mind in kind of, I had to wait a week before my appointment, and during that week, my appetite, when I didn't have much of an appetite, I wasn't sleeping very well, I was just very, very anxious. And so my letter, I was invited, so the appointment itself, I was invited for a colposcopy, which is basically an extended version of a cervical screening, and they basically need to look at your cervix under a microscope, and they use it's like an acidic wash to cover your cervix with this wash, so that the cells show up like white on their microscope, and they can determine kind of next course of action. But on my letter, it did give me some information regarding a particular procedure, surgical procedure, and she did say on the phone in my voice message that I would be invited for a colposcopy and possibly treatment. So yeah, Tuesday of this week is when I had my colposcopy, and I also had surgery on the same day, there and then. So the appointment itself, I am someone who struggles very much with hospitals, medical procedures, that sort of environment. Obviously, if you've been following for a long time, then you know I'm autistic, and I do get very overwhelmed very easily. I get a lot of sensory overload, and a hospital is just a major assault on the senses. There's a lot of weird lighting, there's a lot of noise, there's a lot of hustle and bustle, there's a lot going on. So the appointment itself, my partner came with me, and my mum also met us at the hospital because I wasn't sure who I wanted to go in with me. She did call ahead for me, my mum called ahead for me just to let them know that I am autistic, therefore sometimes need a little extra time to answer questions, just a bit of time for processing. She checked that I could have my ear defenders with me, just a couple of little things like that, and they were really good about it. They were very accommodating, so that was a huge plus. So the appointment itself, I was due to be there for 9 in the morning, and we went up. I was the first one to be seen. I then had to go into a little consultation room. She asked me a load of questions, and then I have to sign the consent form. Because there are risks associated with the procedure that I was going to be having, I had to sign consent and say, yep, I'm aware of these risks. So the procedure itself is called, the shortened version of it is called LLETZ, and that equates to large loop excision of the transformation zone. Yeah, which it's basically a small metal wire, and I believe it's got electrical current running through it, and that is what is used to remove any of the affected tissue on your cervix. Great. After I'd signed that, we went into the room for the colposcopy, which, you know, she just had a closer look. It's a very, very strange experience. You feel very vulnerable. There were 2 nurses, or I think one of them was a nurse, one of them was a care assistant who held my hand the entire time. She was really great. And then the surgeon, clinician lady who carried out the procedure. The colposcopy itself, like I said, it's quite similar to a cervical screening. They have to insert like what's called a speculum, which then opens out and kind of opens out so your cervix is in view for them. So she had a little look, she used the acidic wash stuff, that was fine. I was very painfully aware that there was a big old screen to my right, just kind of there, which I didn't look at. I was good. I didn't need to see that. You know, but that was just a bit like, there's just a big TV on the wall with all my, you know, stuff on show. That's great. So the care assistant who was holding my hand the whole time, she was great. She kept talking to me. And then once she'd done the exam, it was then time for the surgery itself. She had offered me a general anaesthetic beforehand and said I could go back and have that done under general anaesthetic. And to be honest, I'd psyched myself up so much to go in on that day. I didn't want to have to go in again, so I just said no, let's just go with the local anaesthetic. So general anaesthetic, I could be asleep for it. Local anaesthetic, awake and not kicking because I wasn't allowed to move, but you know what I mean, but numb, couldn't feel it. So after the colposcopy itself, it was then time for the procedure, the surgery, and so she numbed my cervix. Now, I don't like needles. Ignore the tattoos, it's different. I don't do needles. I don't do needles in a hospital setting anyway. I get really, really, really not good. Because I have what's called hypermobility, that can affect local anaesthetic, and it usually means I need to have a double dose of anaesthetic. So not only did I have to have the first set of needles with the anaesthetic, I had to have 2 sets of anaesthetic with the needles. And that's a very, very strange feeling, because all of this is internal. All of it's internal, so I can feel needles kind of all over the place, which is great. And then I nearly passed out, which I've been told is also just a side effect of the anaesthetic. So I nearly pass out, then I'm fine again, then I nearly pass out again, and then I'm fine again. And then it's time for the procedure itself. And it was the weirdest thing, because the nurse then explained that she'd have to put a pad on my thigh, like a jelly pad or something, and I said, okay, what's that for? And it was to earth me, so that the lady performing the procedure didn't get an electric shock. So that's really strange, that's really weird. So jelly pad went on, and that was kind of vibrating and doing its thing. That was weird. There was just people kind of standing everywhere. One lady was trying to talk to me. I was trying not to pass out. I did have my ear defenders on, just to kind of block out some unwanted frequencies that were going to cloud my brain. And then we have new chickens. Sorry if you can hear them. And then the machine turned on, and there was a really weird noise. Thankfully, most of it was blocked out with my ear defenders, but I could sense it was just weird. And then the procedure itself did not take very long, and I can't remember if I already explained it a bit earlier in this video, but the point of it was to remove the affected tissue with these cells on it, with the affected high-grade cells, and then they also remove a little area around the affected area, and they're called the margins, just to make sure that they get it all, basically. Once they remove that bit, they then seal you up, which I believe is kind of, they burn the inside of you, like on your cervix, to close that up, which is nice. And then we're done. I say it like it's so easy. It was really quite traumatic, actually. I then had to wait for maybe 20 minutes or so, because every time I sat up, I nearly passed out, so I had to keep laying back down. She did say that was just kind of a side effect of the anaesthetic, and it would go away, it would pass. So I kind of just had to wait until that. And then once it was kind of all over, she did the cleanup, kind of patched me up a little bit. That was when I asked if mum and partner could come in. And as soon as they walked in, as soon as I saw my mum, I burst into tears. I'd already cried twice, actually, I forgot to mention that. I cried once when I was in the consultation room, just answering questions. Then I cried again once I was sitting in the chair, because you have your legs in stirrups. It's just a lot going on. And then I cried again when I saw my mum. So yeah, after that, my mum kind of handled the aftercare stuff. The nurses talked to her because I guess I wasn't really in a good frame of mind. I wasn't very receptive. I was quite washed out. I wasn't feeling very well, and I was just a bit shaky. So mum took care of that for me and got all the appropriate like aftercare sheets for me. And then it was time to leave. And I was quite slow leaving the hospital. I was a bit shaky. I was still under the anaesthetic a little bit, so I was just a little bit wobbly. And then we sat outside for like an hour and a half until I was okay enough to drive, because they did say as long as you're okay when you leave the hospital, you can drive home. But I needed to make doubly sure because I was sat outside the hospital on a bench and I nearly passed out then. I went a bit woozy, so had to wait. So yeah, that was kind of that whole day and the procedure. The last few days since then have been quite strange. The first day I was told not to do anything really, and then the second day, you know, nothing strenuous, kind of just take it easy, and then kind of gradually start returning to my normal activities. Because I don't have like visible stitches, it's almost like nothing happened, but I can feel everything kind of internally, which is very strange. I'm still waiting for my results, because basically what they do, once they've removed the affected tissue, they then send that off to the lab to check the margins. If the margins are clear, then I don't need to go back. If the margins are not clear and they didn't remove quite enough, I'll need to go back and have this done again, which I really don't want to do. So yeah, waiting for those results, don't know how long that will take, but I will have to go back for another cervical screening in 6 months' time just to make sure that the virus has been cleared and that the cells are all back to normal and no more have changed. She did say if there is a risk, there is the potential risk that they will come back, or they can come back, but this surgical procedure is, I think she said, it's effective or it works. I don't know, 9 out of 10 people, and they don't need to have it again. So I'm hoping I'm one of the 9. So yeah, I don't know how well I've explained any of that story. I'm sorry if it was a little bit TMI, but that's just me, isn't it really? So yeah, this is kind of where we're at now. I've been given the all clear from the breast clinic. I have had the treatment to my cervix to remove those cells, although I still need to wait for the results. And yeah, I'm now 5 days post surgery and I feel fine. I've not been in any pain, although it's been uncomfortable, and I've not really been able to like lift anything, because if I put strain like on my abdomen, then I could just kind of split it back open, which we obviously don't want. So yeah, I'm just still taking it easy, but I'm feeling very grateful and very thankful that it wasn't worse. It could have been worse. If I hadn't have had that screening when I did, I don't really want to think about it. I do have my friend Steph to thank for that. She has been on my case for so long about getting this done, but especially the last few months, she's really almost weekly been pestering me, lovingly, but pestering. And yeah, it's kind of because of her that I got this done when I did. But my view has completely changed. My view has completely changed, and I will be eagerly awaiting my next screening just to check that everything is as it should be, and if it's not, it can be dealt with then, you know, there and then, rather than putting it off. So I will be making sure that I'm attending all my appointments, any routine checkups I will be doing, because it's worth it and it's important. It's so, so important. To the very small percentage of you who are still here, I just would like to say thank you for listening to me kind of waffle on for as long as I have. I don't even know how long this video is going to be. I'm going to give myself a little bit more time to heal, take it easy, but I will be getting back to kind of planning all the videos that I had been planning. And yeah, I have a lot of exciting things to film this year. There's going to be a lot of things going on, a lot of changes, and hopefully you will be meeting Bernie's sister, or maybe cousin, because it's not BMW, very, very soon. Don't know what condition she's in, but very soon. So that's all I'll say on that one. So that's a little insight into what might be coming in the next couple of months, few weeks. Thank you so much for watching. Please look after your health, get your checks done, go to your routine screenings, anything like that. Please, because it is so important. I cannot even, like, I know it's scary, I know it can be really scary, but it's so important. I don't know how to get that out to you enough. Just please, I beg you. Take care, and I will see you really soon. Bye.